Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. Today on the program, the coronavirus disease, or COVID-19, now a pandemic with over 118,000 cases.
We're deeply concerned both by the alarming levels of spread and severity and by the alarming levels of inaction.
The first Filipino dies from COVID-19.
Isa ho sa mga rekomendasyon na ginawa natin ngayon ay mabago po yung ating policy on how we admit patients.
How to handle the challenge of testing people for the virus.
Yun din yung mapoproduce nila na enough reagents to be able to test 1,000 patients per week. So magkakaroon pa rin tayo ng medyo may selection pa rin kung sino yung itetest. Hindi pa rin siya pwedeng widely available to the public.
Also, a proposal to lock down the National Capital Region.
Ang issue napakasimple. Gawin mo to para hindi mag-viral o viral to sa gagawa. So, I think what they call premature is preemptive.
Navotas City Mayor Toby Tiangco, PhilHealth Chairman Ricardo Morales, and Philippine Private Hospitals Association President Rustico Jimenez join us in the program. Thank you for joining us. I'm Pinky Webb. President Rodrigo Duterte will undergo COVID-19 testing. In a statement, Senator Bongo says that he and Mr. Duterte will get tested for the disease. Go clarifies that he and the president will undergo testing not because they have symptoms, but to ensure that they are fit and healthy to engage with the public. Meanwhile, President Duterte canceled his visit to Boracay today amid the COVID-19 pandemic. Presidential spokesperson Salvador Panelo says the president's visit will be moved to a later date. Mr. Duterte was supposed to make a tour around the country's top destinations to help boost local tourism. And several government officials and staff are now under self-quarantine due to the coronavirus. Senators Sherwin Gatchalian and Nancy Binay decided to go on self-quarantine. The decision came after they found out that one of the resource persons at a March 5 hearing of the Senate Committee on Education tested positive for COVID-19. Finance Secretary Carlos Dominguez and Transportation Secretary Arthur Tugade are also on self-quarantine after they interacted with people who have the disease. A source tells CNN Philippines Dominguez has not shown any symptoms and has also not interacted with President Duterte since. Executive Secretary Salvador Medialdea also confirms to CNN Philippines that he will undergo self-quarantine and testing for COVID-19. Manila Mayor Isko Moreno is also on self-quarantine following his trip to the United Kingdom. And Bases Conversion and Development Authority President Vince Dizon is now on self-quarantine as well. The agency says this is a precautionary measure after Dizon encountered someone who also tested positive for COVID-19. Let's go straight to the source now. Off the story first. On the line, Navotas City Mayor Toby Tiangco. Mayor, welcome to the show.
Yes, good morning, Pinky.
Mayor was supposed to be with me, beside me here in the studio. However, I got a call from him this morning, quite alarmed or questioning if dapat ba siyang pumunta dito sa studio. Bakit? Let's ask Mayor Toby Tiangco. What was your concern, Mayor?
Hindi, ang concern ko, matatakot ka eh. No, anyway, joking aside, kasi nung pagising ko kanina umaga before I called you, I saw on the news na nag-self-quarantine na nga si E.S. Medialdea, Secretary Tugade, Secretary Dominguez, no? And I think the affair that they were referring to, yung sinasabi ng affair, is the same affair I went to. But the problem is, since for privacy purposes, hindi natin alam kung sino yung nag-test positive sa COVID-19. So, hindi ko alam kung nakatabi ko, nakausap ko, nakamaya, nakasalimuhan ng malapitan, yung nag-test positive. But I have to be responsible as a public official, di ba?
Right.
Posible na nangyari, posible na katabi ko, posible na kamayan ko. Wala po akong ubo, wala po akong tipon, wala akong lagda.
Yeah.
Pero just for safety reasons, I will have to self-quarantine also.
So that starts today, Mayor?
It depends. I will find a way to find out if it is the same affair that we went to. Kasi if it is the same affair we went to, then at least I know the date of that affair and I will count 14 days from that affair.
Yung pong sinasabi nating, ang sinabi ho kasi nila ito, sir, just to be very clear on it, when it comes to Finance Secretary Sonny Dominguez, he said that I was told that a fellow I met with last Thursday and Friday, which was 5 and 6, tested positive for COVID-19 today. I have no symptoms but am self-isolating until I get tested. You may wish to follow suit. So, I guess this is what's important, Mayor. Ang dates na sinabi po ni Finance Secretary ay March 5 and 6. And you're saying that noong pong March when? 6, nakasama niyo po sino?
5 kami nagkasama-sama.
Kasama si Finance Sec Dominguez?
Lahat yan, same yung ES, si Sec Tugade, si Sec Dominguez, madami pang ibang secretary doon.
Yeah.
Saka madami public officials doon. Nagkasama-sama kami, 5.
Kaya sinasabi nyo, sandali lang, let me take a step back and look into more details of this dahil baka kailangan
Pero
din
kagabi lang yata nila nalaman.
Yes, sir.
Kasi kagabi lang sila nag-announce, di ba?
Kagabi lang po.
lang. So kung kagabi lang sila nag-announce, the only common denominator na nagkita-kita kami was 5. Kasi yung 9, yung March 9, that was the meeting at Malacanang to decide, yun yung interagency task force ng COVID-19.
Opo.
But ang nahandun lang si ES, wala doon si Sec Tugade, wala din si Sec Dominguez.
Right.
Pero yung nahandun silang tatlo was, at nahandun din ako, at nahandun din si Presidente at nahandun din si Secretary Bongo, was March 5.
Copy, sir. So, ito naman po ang sunod kong tanong. During that March 9 press conference in Malacanang, you were behind the President. In fact, you were on the left side of the President. So, you know, you look at March 5, that was possibly the meeting. That was the time you were with Finance Sec Dominguez, si Secretary Tugade, na kailangan nyo din po mag-self-quarantine dahil nga may sinasabi ni Sec Dominguez may nag-positive noong March 5 and 6. But then, 6, 7, 8, 9, 4 days later, sir, nandun naman po kayo sa Malacanang, nasa likod naman po ni Pangulo.
Kasi hindi pa naman namin alam nun, di ba, kagabi, kahit
Yes.
sila, kung hindi naman sila nag-announce, hindi ko rin naman malalaman, di ba?
Opo. But I guess...
I mean, kung hindi sila nag-announce kagabi, hindi ko rin naman malalaman na may nag-positive doon sa lugar niya. Pero Pinky, ito yung pinakamahalaga. Imagine that affair, I remember very well, kasi nga dadating si Presidente doon, isa lang ang pasukan doon, isa lang ang labasan. Though, on that date, sandali lang si Presidente doon, nag-speech lang, I didn't have close contact with the President on that date.
What date
Pero
is this?
Pardon me?
Which date are you talking about?
Yung March 5.
Opo, okay.
Yung March 5. He was there, pero nag-speech lang siya, sa stage siya, then he had other meetings, so he had to leave at 1. So, walang socialization nun. But ang sinasabi ko, isang pasukan lang yon, isang labasan. At lahat kami kinukunan ng temperature, ng PSG, lahat kami linalagyan ng alcohol. So that's why social distancing is so important. Yeah. That's why napakahalaga yung sinasabi ni Presidente ng press conference sa social distancing. At huwag na tayong pumunta sa matataong lugar kasi katulad ng sitwasyon namin.
Opo. Wait, before you go on, Mayor, sandali lang because may naisip lang po ako, posible ho kaya na nagkaroon ng ibang meeting itong sinasabi ni Sec Dominguez na March 5 and 6. I'm just thinking, sir, that, you know, you must have been busy, the cabinet secretary officials must have been busy as well. They may have lined up a number of activities. Posible ho kaya yung sinasabi ninyo ay iba doon sa sinasabi nila Sec Dominguez at Sec Tugade?
Okay, titignan ko lang. That's why I think it is the same because may nag-tweet na reporter na sinabi niya kung ano yung affair.
I see. Kaya doon po kayo napunta.
May nag-tweet na reporter
That's okay,
na
sir.
sinabi niya kung ano yung inquirer.
Okay.
So sinabi niya kung ano yung affair.
Aha. And then that's why you're saying nandun kayo nung affair na
Eh,
yun.
nandun ako sa affair na yon.
Apo. I'm just thinking, sir, that let's say, March 5, posible naman pong may isa siyang meeting dito and a number of meetings thereafter, and he could be referring to something else. But okay, be that as
No,
it may...
it's here. Teka, hinahanap ko lang nandito sa phone ko. Sinabi ko anong affair
Okay.
Sinabi sa NLEX NLEX blessing.
Okay.
So, nahandun ako dun sa NLEX blessing.
Okay.
Yeah, no, Mark Camus.
Okay. All right.
Miguel R. Camus Inquirer. Sinabi niya na it was during the NLEX inspection.
All right, but best siguro, Mayor, I'm sure you'll find ways to be able to talk to everyone else who was with you during that March 5 meeting. Let me move on, sir. So,
Yeah, but the problem is they cannot tell me who it is because of data privacy.
yeah. But at least you'll ascertain and confirm, sir, the event. Yun po yung aking tinutukoy. But, sir, I need to move on.
I talked to one, hindi isa sa kanilang tatlo, and he confirmed it's that
It's
affair.
that event also.
Also a cabinet secretary.
Okay, let me move on. Sir, kasi I was with Congressman Joey Salceda and he's still pushing for a lockdown sa NCR. Is this something you support? I ask this, sir, because kayo yung isa sa mga una nagsabi dapat wala nang pasok. In fact, you were urging the Department of Education na ipasa na lang yung mga estudyante.
Okay, ipaliwanag ko muna. Sinabi ko yun nung Sabado. Wala pa tong lahat na to. Pero lumabas lang yung first few cases ng COVID-19. Kaya ako sinabi yan, it's because nga of a situation like this. Kung may isang estudyante doon, anong gagawin mo? Yung buong school, itetest mo, kulang na nga tayo sa test kit. Ang sinasabi ko naman ipapasa lang is yung bagsak, naku konti, baka 1% lang. Lahat naman ng estudyante may general average at 10 days less na lang from March 9 to March 20. March 20 tapos na pasukan. So siguro naman 95% ng ituturo ng mga teachers naituro na nila o 98%. So why will we take the risk? Ano ba yung numero ng 1% na ipapasa? Okay, doon sa lockdown, I will explain bakit napaka-importante ng social distancing ngayon.
Okay.
Because yung lockdown is the next step. Kung wala kasi sila noong presentation ng Interagency Task Force on COVID-19 last Monday, the first recommendation is no classes. Okay? Pag hindi umubra to, doon tayo pupunta sa kung saan ihinto ang recommendation. Next recommendation, the next stage is isasara mass transport, maghihinto ang opisina. Imagine kung ano mangyayari sa ekonomiya natin kung ganyan gagawin natin. So ang ibig sabihin, kaya nga sinasabi ko ever since before, doon pa lang sa proposal ko na walang pasok, it was a preventive measure.
Right.
Yung ginagawa natin ngayon, na walang pasok yung mga estudyante tsaka social distancing, it's a preventive measure again.
All
So
right.
we have to take this preventive measure seriously. And in actuality, the recommendation of DOH experts, not only the secretary, the DOH experts was more than 5 days.
All right. Okay.
Was
Sir,
more than 5 days. So 5 days was a compromise. And on the 14th, the Interagency Task Force will meet, evaluate, and recommend again to the President kung ano yung gagawin.
And we'll
Pero
await-
kung ayaw natin umabot doon sa lockdown, mag-social distancing na tayo ngayon pa lang.
okay. And magkakaroon po ng meeting ulit today or tomorrow, sir, to look into what should happen
14,
next week,
14.
no? Yeah. So in the
14.
meantime, Mayor Toby Tiangco, sir, maraming salamat po sa inyo and we'll continue. Yung kapatid niyo po, nag-self-quarantine na rin, sir?
Yes, magkasama kami doon Pati
okay.
Vice Mayor ko kasama namin doon Tsaka ibang mga mayors kasama din namin doon
Okay, all right. Maraming salamat, sir. We'll be taking a short break. Coming up, can private hospitals handle a surge of COVID-19 cases? We'll speak to the head of the Private Hospitals Association. After the break, please stay tuned. You're watching The Source on CNN Philippines. Our guest today joining us through phone, Private Hospitals Association of the Philippines Incorporated, or PHAPI President, Dr. Rustico Jimenez. Dr. Jimenez, welcome again to the show, sir. Unahin ko na po yung tanong, ano ho ang reaksyon ng mga private hospitals now that there was an announcement from Malacanang, specifically Cabinet Secretary Carlo Nograles, that sasagutin na daw po ng PhilHealth ang mga pag-test sa COVID-19 patients?
Mabuti naman po yon kasi tutulungan natin ang ating mga mahihirap na pasyente.
Paano ho kaya, Doc Jimenez, yung method nung pagpunta sa ospital? Kasi alam po natin, ang pagkaalam po namin, wala pong test kits sa mga hospitals. That's correct, no, sir?
That's correct kasi nga re-refer namin sa RITM.
Okay.
Yung pinakamalapit, for example, sa Parañaque, yun ang pinakamalapit.
Kasi ang RITM ang nagtetest. Kailangan ipadala yung sample doon sa RITM. So, help us understand, Doc. Sabihin po natin may pasyente, gusto magpa-test. Papaano ho kung sabihin ng ospital, you don't qualify kasi hindi pa masyado mataas ang lagnat mo, hindi naman matindi yung ubo mo. Can hospitals actually refuse someone na gusto pong magpa-test sa COVID-19?
Ayun po ang policy ng ating DOH. We have to centralize the testing kasi baka magkaroon ng false positive or false negative.
Ano po ibig sabihin nun, sir?
Kasi meron ng mga test na available sana pero hindi naman accurate yung result. So baka lalo tayo magkagulo-gulo, lalo tayo magkakaroon ng chaos. Dahil sa baka false positive pero negative naman, then ka-quarantine natin, siyempre it will affect the economy of the country.
So, ibig sabihin, Doc, maaari at hindi po pwedeng magalit sa mga ospital na ayaw pong magpa-check ng COVID-19 patients. Tama ho?
Kasi nga ho, wala ho kaming testing kit sa mga private hospital.
Right.
Sinicentralize po ng DOH. Binigyan po kami ng listahan ng mga available na government hospitals pero it is available all over the Philippines. May pangalan po yon, may cellphone number, at saan lugar yung available. Doon po pinapadala ng mga private hospitals yung mga test na kailangan.
Hindi lang ho ba sa RITM?
Hindi po, marami po sa all over the Philippines na available yan sa government hospitals.
Aha.
Pero ang centralized talaga RITM.
Ibig niyo sabihin may mga ospital all around the country that can actually test COVID-19?
Meron po, kasi yun ang binigay namin sa amin ng DOH na listahan. Doon kami makipag-coordinate. For example, nasa Mindanao, meron pong hospital doon na pagkukunan ng testing. Sila po ang magre-refer. Kung wala pa sila, di i-refer din nila sa San Lazaro or RITM.
I see. Okay. So, malinaw na ho kaya, Doc, dun sa, meron na ho ba kayong mga policies or measures in place dahil nga because sasagutin na ng PhilHealth itong mga COVID. Kasi ganito ho yun, kunwari papasok ka sa ER, meron kang simptomas and then you're a candidate. So kukunan po ng swab yung pasyente. Makakalabas po yung pasyente na wala nang babayaran. Simula ngayong araw ho, pwede na ho yun dahil sabi ng PhilHealth sila na po ang sasagot sa COVID-19 tests?
Nagpadala na po sila ng announcement, so it will be covered. Kaya meron ng mga requirements doon kasi baka lahat sasabihin libre naman paggawa na lang.
Totoo.
Pero i-evaluate pa rin po ng doktor at nurse doon sa emergency room na trials namin before entering the whole hospital na kung talagang may history siya. Kasi it depends also on the doctor kung talagang it's possible na talagang meron siyang COVID.
Kung parang highly suspicious siya dito
Opo.
sa COVID-19. Alam niyo,
Otherwise, magpupulo po lahat ang ating hospital facilities, hindi naman po kailangan.
yung iba ho kasi sumasama ang loob dahil meron po lumalabas sa social media na mga statement na antindi na raw ng kanilang sakit, ubo, at sipon, pero ayaw pa raw din sila itest ng COVID-19. At the end of the day, Doc Jimenez, parang lumalabas, it's upon the recommendation of the attending doctor.
Yun pa rin po, kasi po, no one can really justify the test kung hindi naman na-examine ng doktor. Requirement lang ng pasyente or relative. Yan po ang sinasabi namin before doon sa illegal detention at yung deposit. Kasi ang final judge pa rin po ay yung doktor na makaka-examine sa pasyente at makakakuha ng history kung talagang qualified siya to have the test.
Okay. So ganun pa rin po.
Opo.
It's still the same standard for the public to know. Ganun pa rin yung standard, hindi nagbabago. Pero ang nag-iba lang po ay libre na ito. Doon sa mga sasabihin ng doktor na, okay, magpa-test ka, papayagan magpa-test ng COVID-19. Yung pong mga private hospitals na nangyayari po ngayon, yung capacity po kamusta, Doc Rustico, sa inyong mga miyembro? What are they saying?
Yun nga po, basta sinabi ko naman po yun before na we have 1 or 2 infectious room lang sa bawat private hospital. Requirement ng lubo yun ng DOH. So, yun lang po ang mapaglalagyan ng pasyente if ever positive or gusto ng pasyente doon sa private hospital makumpine. After that, wala na pong facility yung hospital. Hindi naman po pwedeng gawin na yung private room gawing infectious kasi mamamatay din yung aming mga health workers. Wala no, magtatrabaho, kumahawa lahat.
Mabilis lang po, Doc, anong pinakamalaking challenge ngayon sa private hospitals?
Ay di, kailangan po mag-provide ng personal protective gear yung ating mga hospital to protect the workers also. Kasi, remember, marami po tayong sakit ngayon. Usually, summer, marami po tayong sakit na usual na nakikita sa hospital. Kung kasama pa yung mga COVID patients, ma-overwhelm po tayo.
Maraming salamat po sa inyo. Doc Rustico Jimenez ng PHAPPY.
Salamat.
Thank you, sir. We'll be taking a short break. Up next, the government says testing for COVID-19 is free, but who can actually avail of it? We'll speak to the PhilHealth chief, Ricardo Morales, after the break. This is The Source on CNN Philippines. Please stay tuned. You're watching The Source on CNN Philippines. Now we'll speak to PhilHealth President and CEO Ricardo Morales. Sir, Mr. Morales, good morning and welcome to the show, sir.
Hello, good morning, Pinky, and to all listeners, good morning.
Opo. Sir, unang-una, yung mga hospitals ho ba, have they formally been told that all tests for COVID-19 are going to be free and carried by PhilHealth?
Well, we advise them that PhilHealth will pay for all the costs associated with the COVID-19 situation. Before this, we already advised them not to turn away patients seeking medical attention if they suspect that they have been exposed to COVID-19. And we have prepared a package to support the patients if they get confined and quarantined.
May I find out, sir, ano po yung package sakaling ma-confine one patient of COVID-19?
Well, first, we have the referral package. It's about 4,000. If they get referred from the primary healthcare provider, at nilipat sila sa level 2 and 3 hospitals, which are supposed to have isolation wards.
Opo.
And then we have the quarantine package for 14 days, which is 14,000, about 1,000 per day to cover for the quarantine period. And then if the patient develops a full-blown COVID-19 condition, we are prepared with the severe pneumonia package, which is the closest we can have right now.
Opo.
So PhilHealth case rate to cover yung COVID-19. And then additionally, we're also prepared to cover the tests that will be conducted to determine COVID-19 condition.
That's a whole package, sir.
Yes.
Opo,
the
hindi lang
package.
test kits pa lang i-cover ninyo.
Yes, oo. Hindi kasama yung test kits, but it will be over and above the package that we have already prepared.
Apo. So, the question, sir, is this. Meron po kasi mga nagsasabi, kahit na pumunta po sila sa hospitals, they have to be qualified to be able to do the test dahil nga hindi naman po ganun kadami yung supply natin sa test. Would you be able to help us understand a situation wherein a patient cannot undergo a COVID-19 test because the doctor says you're not a candidate right now?
Yes. The health professional will decide whether a patient should undergo COVID-19 testing. PhilHealth will just pay for the cost of the test. So the professional will decide kung he needs this test. The patient needs the test.
Okay. Understandably, sir, kasi that's why PhilHealth comes in to be able to cover this. The problem really in the beginning, sir, was masyado daw mahal yung test, kaya nahihirapan din yung ibang tao to undergo the test. Would you know, sir, magkano ho ba yung test for COVID-19?
As I understand it, that tests right now that are available that we have been sourcing from overseas about 6,000 to 8,000.
I see.
per test. But I think the UP is coming up with a test package is more reasonably cost. So either yung 6,000, 8,000 or 1,000, PhilHealth will still foot the bill.
Apo. Sir, are you prepared? Are there enough funds sakaling pong lumobo itong mga pasyente na kailangang magpa-test ng COVID-19?
Yes, right now, PhilHealth is liquid. So we are ready to cover the cost of this testing at the present rate. And even pag nag-expand pa ito, PhilHealth is ready. Siyempre, pagka-epidemic na to, which nobody wants, and precisely why we're doing these things, we will have to siguro review again our regime to see if we can extend our resources. But at present, that's not a concern. PhilHealth is liquid enough.
Yeah, how much are you putting in place for this, sir, initially?
Well, our reserves are about 200 B, so that will be available.
200 what, sir?
Ang current reserves ng PhilHealth is 200 billion.
I see. Okay.
So, but I don't think we're going to need all of that because
Right.
may mga ibang requirements din naman yung ibang health needs. So,
Okay. Very quickly, sir, maybe an advice to the public. Siguro kung magkaroon sila ng problema. Yeah, go ahead, sir.
Yes, our health authorities have put out a protocol and guidelines as to yung behavior natin individually, not to panic and to follow common sense and proper hygiene. No? So I think there's no need to panic. We are putting in place a response mechanism that will answer all the health requirements, the cost of the testing, and whatever other health care is needed. So we are ready to respond to this emergency.
Basta, sir, kailangan ngayon, it's important, no, for the public to know that if you go inside a hospital at kailangan yung magpa-test sa COVID-19, wala po silang babayaran.
That's correct.
Okay.
Under universal healthcare, all citizens are entitled to healthcare.
Maraming salamat. PhilHealth
Okay.
President and CEO Ricardo Morales. Thank you, sir. And thank you for joining us here on The Source. I'm Pinky Webb. You're watching CNN Philippines.